Botox may sound like a quick fix and a great fix for your pelvic pain, but is it really helping or is it causing deeper problem? That's the subject of this video. In this video, I'm going to explain to you why or when usually Botox is recommended and what my opinion on the whole procedure is and why that, in my opinion, is not going to materialize the results you're after. Then I'm going to offer the solution that I see in my practice, which definitely materializes from what I witness here. So first of all, let's talk about Botox. Botox is a botulism, that injection. This paralyzes the muscles, and this is typically offered for cases where there's a lot of tension, and the tension inside the pelvis is what is suspected to cause the symptoms that the individual may have. These symptoms can vary from person to person and from area to area. Let me explain. Inside your pelvis, you have a whole bunch of muscles. These muscles are all voluntary, meaning you can decide to contract and you can contract them. Now, inside this resides your pelvic organs. Pelvic organs are your bladder, your intestine, and in the middle of those two is your prostate if you're male, or it's your uterus and ovaries if you're a female. When the environment inside this gets tight, it can put pressure and therefore symptoms associated with those organs. And also within this area resides nerves and blood vessels. So you can have pelvic instability causing action or pressure or unevenness of these muscles. And then that can turn into, let's say, pelvic congestion as an example. So a lot of times different procedures, different things are done, and then the solution becomes Botox. They go in and inject the muscle to get rid of that tension. But here's the question I have for you. What's the opposite of tension? It is relaxation. It is not paralysis. So when you paralyze a muscle, now you go to the other extreme. That muscle has no chance of working. And most often, that injection is not done precisely. Even when it's precisely, I'm against it for the very reason that we're paralyzing a muscle. So instead of trying to paralyze a muscle, shouldn't we look into why there is so much tension? Because even when you paralyze it, you never look into the reason why it was tight to begin with. So the reason for it is still there. And from my perspective, which is biomechanical perspective, I want to stabilize the house that pelvic floor is the floor of. I want to stabilize the house that the muscle inside are so wrapped up in trying to stabilize that the pelvic organs, the blood vessels, the nerves, and all the structures, the things that are connected to the pelvis, like your spine and your lower extremities, all of those are being compromised by. The solution is not paralysis of the muscle. The solution is looking into the degree of instability of the pelvis and the degree of the work that needs to be done to stabilize it. You see, the muscles inside of your pelvis work with the outside area to stabilize the pelvis, and that's because your pelvis is the foundation to the structures above. Without your upper and lower extremities, you're disabled. You still get to live. But without your trunk and your torso, you are not going to live. So this foundational stability is critical to your existence. So you have double layering of muscles inside with the outside to stabilize this, and what's not happening on the outside needs to be made up by the muscles inside. So you're wasting your time, in my opinion, to want to inject yourself with botulism, Botox, to get rid of your pain. So your pain will go away, but with a much, much worse issue, because you did not solve the problem. From my perspective, what I do with my patients and what I see materialize beautiful results is we work with biological breathing. I'll put a video at the end of this showing you how that's done, because that's how naturally you condition and you strengthen these muscles. Every breath, when done biologically, in the process of breathing in, relaxes these, and in the process of breathing out, allows these muscles to work together to contract, to then allow exhalation, breathing out, to take place. If you change the environment to what the body likes, you will always get the result that you're after. This is like having a plant that is not looking good, and you come to me and you say, well, my plant's dying, what should I do? And I'm like, well, you're putting this plant in the sun, you're overwatering it, and the fertilizer is wrong. Is it surprising when you don't put it in the sun and you put it in the shade, which was where that plant thrives, and then you don't water it as much, and you also give it the right fertilizer, then it materializes? No. Hope this made sense. If you have not subscribed to my channel, do so. Contact my office with any questions or comment below. I would love to hear your thoughts. Thanks for watching.